Venetoclax is a potent BCL2 inhibitor which has shown very impressive responses in other B-cell malignancies, particularly CLL. And there are data with Venetoclax in patients with Non-Hodgkin lymphoma, 28 patients from a phase 1 study showing a response rate of 75%. So this is an agent of real interest in mantle cell lymphoma. But to date, there are no data following BTK inhibition. BTK inhibitors, particularly Ibrutinib, have been studied in relapsed refractory mantle cell lymphoma, where the average survival, if you take all comers, is approximately 2 years. And the median progression-free survival of patients typically on Ibrutinib is improved if you use it in the first relapse setting. And certainly there is very much a vogue for using Ibrutinib now in the first relapse setting, given these data. As such, patients will often be exposed to BTK inhibitors in this setting, and it is likely that patients will continue to progress following Ibrutinib because there are no plateaus on the survival curve, and this is not a curative therapy. As such, there will remain an area of unmet need at present in the post-BTK inhibitor setting. Venetoclax has been studied in the study that I presented in 20 patients across the UK. This is a retrospective analysis of a compassionate use program supported by AbbVie, who provided Venetoclax free of charge for 20 patients. The patients were high risk. They had high clinical risk features, including a high simplified MRCP score, high number of extranodal sites, and also poor performance status, as well as a progression-free survival to their previous BTK inhibitor of only 4.8 months, which compares very unfavorably with the comparison of the progression-free survival in the clinical trials, which is somewhere between 14 to 15 and a half months. As such, this patient cohort was high risk, and as a result of that, the progression-free survival was fairly limited, with a progression-free survival overall of 3.2 months and an overall survival of just over 9 months. But the response rates initially were 60%, and there were some complete responses in that group, 20% complete response rates, and some of those were durable. And so this is clear evidence that Venetoclax is an active therapy in the relapsed refractory setting post-BTK inhibitors, and compare relatively favourably to the data of immunochemotherapy in this setting, which suggests a response rate between 30 to 40% and a median progression-free survival that is short, and an overall survival that's between 4 to 8 months. And so this provides clear evidence of Venetoclax monotherapy being effective in mantle cell lymphoma in the post-BTK inhibitor setting. The responses and progression-free survival was no different compared to whether you responded to a BTK inhibitor prior to the Venetoclax. And so what this does do is it provides further rationale for combination therapy with a drug that's otherwise fairly clean with relatively minimal side effects. So this is an interesting study, and certainly Venetoclax in this setting is worth investigating further with combination therapies, and this is ongoing.